As we pass the 3-year anniversary of the opening of the exchanges, most news seems to focus on the private insurance people can purchase there. In recent months, many have complained about private insurers exiting the exchanges, networks being narrowed, premiums rising, and competition dwindling out of existence. But it's important to remember that many, if not most, of the newly insured are part of the Medicaid expansion. As of today, 19 states have still refused to participate in that program. Some cite reports in news that Medicaid offers poor quality and little choice of providers. But most are worried about the expense of Medicaid, claiming that its growing cost will eventually bankrupt them. Such declarations only consider one side of the equation, though. In most ways, Medicaid offers an excellent return on investment, and that's the topic of this week's Healthcare Triage. A rigorous analysis of the health benefits of being insured shows that Medicaid works. Critics of Medicaid will often point to some studies that show that having Medicaid is associated with poor outcomes, even worse than those for the uninsured. Such studies are often flawed, though, in that those on Medicaid are often poorer and sicker than those who remain uninsured. Some good randomized trials do exist. The Oregon Health Insurance Experiment is one of the most recent and well-known. Many news stories have been written on the short-term findings of that study, but it's possible that such studies are underpowered to see the population benefits that result from insurance. For longer-term population benefits, we need to turn to other types of studies. They exist as well, usually taking advantage of changes in policy. Medicaid coverage of children and births expanded rapidly from the late 70s through the early 90s. When mothers gained early prenatal coverage, babies were less likely to be obese when they grew up. They had fewer hospitalizations, especially preventable hospitalizations, related to a number of chronic disorders. Another study from last fall went further. By exploiting new Medicaid eligibility policies, researchers were able to follow people on Medicaid as if they were in a more controlled trial. They found that adult African Americans who had more years of Medicaid eligibility as children had fewer hospitalizations and emergency department visits as adults. There also appeared to be a dose response in that more years of coverage achieved better results. They also had lower mortality rates as they aged. Benefits from Medicaid extend outside the strict domain of health, though. A 2016 NBER working paper examined the effect of the Medicaid expansion on financial outcomes of beneficiaries using credit report data. Researchers showed that the expansion was associated with a reduction of collection balances from $600 to $1,000 for those receiving Medicaid. Other financial benefits to society. A study from early 2015 looked at how expanding coverage to Medicaid and CHIP in the 1980s and 1990s affected long-term financial outcomes. The analysis showed that children whose eligibility increased were more likely to go to college, earn higher wages, and pay more taxes by the time they're 28 years old. In fact, after accounting for other factors, the researchers estimated that the government would recoup 56 cents on each dollar spent on childhood Medicaid by the time beneficiaries reach age 60. Other studies confirm that Medicaid in childhood makes kids more likely to finish high school and college, which translates into improved outcomes in many domains. At a national level, the expansion of Medicaid also continues to yield benefits. It's associated with increased coverage and the quality of coverage. Some states that have expanded Medicaid are even seeing net savings for the next few years. In states where Medicaid was expanded, hospitals saw many fewer uninsured visits. But focusing only on the positives can be as problematic as focusing only on the negatives. It is true that increased coverage by Medicaid results in an increase in public coverage over private insurance, which many find problematic. It is true that providing Medicaid can cost the federal government and even states significant amounts of money, which can't then be spent on other worthy pursuits. It is true that Medicaid reimburses physicians and hospitals less generously, and that it often leaves beneficiaries with fewer choices than private insurance might. But these negatives must be weighed directly against the positives. Medicaid coverage seems to result in health benefits. It provides financial security. It leads to societal improvements through education. It even leads to a decrease in tax expenditures and an increase in tax revenue over time. Policy decisions, including those involving health, need to be considered in terms of trade-offs. We can't just recite the facts that support our prior assumptions. But when we look at the balance sheet for Medicaid, including the expansion, it's not hard to argue that money allocated to Medicaid is well spent.
Healthcare Triage is supported in part by viewers like you through Patreon.com. a voluntary subscription service that allows you to support the show through your monthly donation. We'd like to thank our research associates Joe Sevitz and Karen Green, and our Surgeon Admiral, Sam. Thanks, Joe and Karen. Thanks, Sam. More information can be found at patreon.com/healthcaretriage.